In this video, I'm going to be discussing whether or not COVID-19 deaths are really being overinflated. I'm Dr. Michael White, Distinguished Professor and Chair, Pharmacist and Researcher at the University of Connecticut School of Pharmacy. Thank you very much for tuning in today. One of the big things that we hear a lot from people in social media is follow the money. If you follow the money, you'll know whether or not this is a hoax. Well, let's do that. Let's follow the money. The U.S. government is estimated to lose trillions of dollars before this is all over. States are going to lose billions of dollars, and cities and towns are going to lose millions due to COVID-19. There's no incentive at any of those levels for people to fake the severity of this situation. While you may say or you may believe it's plausible that a vaccine maker or a pharmaceutical company may want to make several $100 million or maybe $1 billion selling a drug, selling a vaccine, do you really believe that they would have the ability to sell this hoax idea to the government? By the same token, do you think that companies like Boeing and Delta and Disney, GE and GM, 3M, ExxonMobil, Ford, all the major universities, all the doctor's offices, all the dental offices, all of the major restaurant chains, and hundreds of others would allow this to go on without any attempts to fight? It doesn't sound like it makes a lot of sense. But hospitals have to be making tons of money, right? I mean, the hospitals are where they're seeing all of these COVID-19 patients. Well, the reality is, hospitals individually are losing tens of millions of dollars and collectively could be losing billions. Now, people have said, oh, well, you get more money for a COVID admission than you do for a regular admission for a respiratory ailment. Well, that's true. But the reason that that's true is because the people are coming in and they need a higher level of care. And they're being hospitalized for a very, very long period of time. The hospitals would much rather be doing the knee replacements, doing the ablations, doing the other elective procedures that they were doing, and just seeing the regular people that were coming in for regular ailments, not because they're making money. The truth is, hospitals are losing money on COVID-19, and they have no incentive to try to inflate the number of COVID cases. The next thing I've heard a lot of is that these COVID-19 deaths are just deaths that were due to other pneumonias or just death that was due to the flu. Let's look at this figure very, very carefully. You see those two black lines? The two black lines are telling you, in a normal year, this is how many deaths people would be expecting from the flu and from pneumonia. Now you can see in the first year all the way over here on the left that there were some increases in death, and those increases in death was because the flu year was particularly bad. In the middle, what you see is that those deaths from pneumonia or the flu followed the absolutely normal, typical pattern that we would normally expect to see. The year after that, 2019 going into 2020, you can see it was also showing exactly what it was supposed to show in terms of the number of deaths from pneumonia and the flu. The cases were already starting to come down when suddenly they jumped. The reason that they jumped is because of COVID-19. It's impossible to look at data like this and come to the conclusion that people are taking flu deaths or people are taking pneumonia deaths and they're misattributing them. So now, let's look at overall deaths. Are people just taking the deaths that normally would have been occurring and saying that they were COVID-19 deaths to try to make things look worse? If you're like me, you've seen a lot of people contend that that is true online. Well, let's look at a number of different states and see whether or not that's true. Well, you can see there with the regular colored lines the deaths that had been reported over this time period for the past 5 years. And now, look at the deaths that are being reported this year. It is very clear for you to see that they're not just taking other deaths and reattributing them to COVID-19 deaths. And why would it? Let's look at this graph. This is also not occurring anywhere else in the world. So even if you believe that the U.S. government or U.S. governmental agencies are trying to mislead you, why would all of these countries around the world also be telling the same kind of story? If you think about it logically, there's really only one reason: because it's true. COVID-19 has been a very severe disease. It's caused a lot of issues, and if they didn't take dramatic action, it would have been an absolute catastrophe. Now that we are reopening, we need people to be sensible about how we're reopening and not believe that it's a hoax, or you're going to put yourselves, your loved ones, and your fellow citizens in danger. Thank you very much for joining me today. I hope that it was informative, and I hope that it was able to answer some questions that you might have heard so that you can make the choices that you need to keep yourself and to keep others healthy and happy. Thank you.